Never had an issue one time with these folks. They were the nicest people I've ever dealt with.
Everybody here was really friendly, easy to work with.
Ballantuyne Center for Dentistry opened up avenues for me that I didn't know existed.
The customer service was excellent. It happened exactly the way he described it is going to be.
My name is Dr. Joe Hafanda. My practice is Ballantuyne Center for Dentistry.
My name is Dr. Christian Yaest. My practice is the Ballantuyne Center for Dentistry in Charlotte, North Carolina. I graduated from the University of Michigan in 1996 from their dental program, and then I decided I was going to move down south where it's nice and warm, and my wife and I moved to Charlotte, North Carolina, where I joined a residency program at the Carolinas Medical Center.
As long as I remember, I've always wanted to become a dentist. And both my parents are in the medical field, and being that we visited them in a hospital setting and would go to their work, I knew that wasn't for me. Dentistry marries form and function, and I have an artistic background with both music and art, and dentistry really encompasses both of those as well. So dentistry is both functional and artistic, and I said, you know, what better thing to do than get into a field that really satisfies me and is rewarding as a career.
Never had an issue one time with these folks. They were the nicest people I've ever dealt with. They made everything easy. They answered all my questions. They were thorough and made me feel at home every time I came. Oh, very happy. I get a lot of compliments on my teeth now. My biggest issue is I was having trouble not being able to chew my food properly, and I enjoy food, so being able to get out there and enjoy a good steak and anything I wanted to eat, it's become paramount to me, so I'm very, very pleased. Well, it's allowed me to smile more, certainly, so that's the first point. But it's also changed my life because I'm able to eat things that I wasn't able to eat previously. And I feel like being able to chew and digest your food properly is a way to have better health. So in many ways, it's made me feel much better about things and much better about my life. Oh, everybody notices a big difference. The feedback I've gotten back from my friends is that I look great, that I look like I'm healthier, which your appearance will help you do that. Plus, I'm more confident in being out in public, and I'm enjoying eating again, which is a big plus for me.
I had a lot of feelings. I had some loose teeth. I was just constantly worried about, you know, my teeth. It seemed like every time I turn around, a feeling would fall out or something. I'd have to have that redone. And like I say, I was getting to have some loose teeth too. And I just felt like I needed to do something, and I didn't want to have dentures. I've been hearing about them for years on the radio, Ballantyne Dentistry every day. But I looked into this some because I knew that my options were limited. Like I said, I didn't want to have dentures. So I had already looked into the cost and everything. I'd done some research, and there was other places here that could do it, but they've been doing this for a while, and they must be doing something right, because Ballantyne Dentistry has been here for a long time. And so I felt better about coming to them. And once I met with Dr. Yaest, we scheduled it. Everybody's been real impressed with it. I love it. It looks so much better. You know, especially when you're meeting somebody the first time, you know, when your teeth get to a certain point, you're worried more about them looking at your teeth than anything. And that's just been a great relief. And a lot of people are really impressed with it. My smile looks now. First time I got to see my new teeth was, it was my temporary teeth, but it was so much better than looking at what I had before. And once I got the permanent teeth, I mean, I was really excited to get them. It looked so different. My teeth never looked this good. Even when I was growing up, my teeth would never look this good.
Getting to this point was a long road. In my mid-20s, I used to race motorcycles. One summer, I had a real bad accident, ended up breaking up my jaw. Result was, I ended up with 3 different bridges in my mouth, one across the top and then 2 on the sides. Recently, the one on the side on the lower bottom broke loose. Actually left 5 teeth broken off at the gum line. I wouldn't say as much impacting my confidence level as making me aware of what my teeth look like when I'm speaking. You know, I just became a little ashamed, if we could use that word, that you know, people were noticing it. Heard about Dr. Joe first on a local AM talk station. So when I had made the decision that I wanted to go beyond bridges and the teeth the way they were is when I started going online and reading about the process, reading about Dr. Joe, and which ultimately led to my decision to go talk to him. Probably the number one thing I'm looking forward to is having a nice smile. It's been a long time since I've been able to smile and not worry about somebody looking at my teeth and judging me. The second thing is I'm going to enjoy a good steak. I'm looking forward to be able to really chew into a good steak and enjoy a good meal.
When Bill had come to us, he had a history of a motorcycle accident that really wreaked havoc with his teeth. He had his teeth rebuilt. For years it served its purposes. I think he had a lot of bridge work done. Over time, the bridge work started to fail. Well, he knew the days were numbered when it came to his existing dental work. He came to our office. He said, "Listen, man, lay my options out for me." We talked about his dental implant options, and he said, "Man, if that's a stable option for me and I can look good and I can eat, let's do it." We are talking about removing teeth, placing implants, and tightening down a set of teeth onto those implants so that way when Bill wakes up, he has a new smile that's got some stability, looks good, and functions well. It's a 6-month process where healing and integration takes place so that he has something that lasts him a good long time, looks good, and functions well.
You know, I gotta say, I really felt like I made a good choice here. I mean, everybody is super friendly. Dr. Joe is probably one of the friendliest dentists I've ever been around or been associated with. Just everybody in this office is extremely professional and helpful. As far as the overall outcome, I'm extremely happy. I mean, it's everything that I'd hoped for. I'm very pleased with the quality of the work, with my appearance. My friends tell me I look happier, and that's probably the most positive feedback I've had. My wife constantly tells me how much better I look. I have no fear of smiling. I love to smile, and I no longer think about it when I do. It's just a natural reaction for me, and I enjoy that feeling of just showing people that I'm happy in the inside.
I think one of the things that makes us unique at the Ballantuyne Center for Dentistry is the fact that we try to do everything here under one roof. So for adults, we have just about every service imaginable, and we very rarely have to refer patients to other dentists or specialists to get different things done.
Well, we do everything a general dentist would do. Meaning root canals, fillings, crowns, bridges, dental implants. At this point in juncture, we still do everything that most general dentists do. However, we have added a component of the surgical part that really embodies what people are looking for today when they are looking at having to lose their teeth. And most people don't want to have something that they identify as treatment that their grandparents had. So they're looking for solutions that fit their budget and lifestyle, yet something that really gives them security, the confidence to smile, the ability to eat and chew. So that's what kind of what we've been looking at as of late.
One of the things that I feel really strongly about, and I think sets us apart from a lot of dental practices, is the fact that we have a fantastic team of individuals that we've collected over the last few years that act as not just dental assistants and dental hygienists and business team members, but they all consider themselves advocates for our patients. And it's a really special feeling to be able to come in and work with people that care about the patients as much as we do.
I think what makes our dental facility something someone seeks out is that we have done a lot with our online presence and letting people know here in Charlotte, this is what we do. We do a lot of the general dentistry, but also have kind of branched off into doing a lot more of the surgical aspects where people are looking for these types of options. They come to us because they are looking for hope. They come to us because maybe in their past experiences they've been told, really there's nothing left but to do dentures. And no one really wants to have something that they kind of identify with their grandparents. They want to feel youthful. They want to feel like they can go out. They want to feel like they have confidence.
Basically, before my procedure, my life was in shambles. I chipped a tooth when I was very young in age. Started with my teeth off being pretty bad. But then later on in life, I started to get even more problems, and it started to actually go up into my cheekbones and to my jaw. So I eventually knew I was either going to lose facial parts or needed to get the work done. So it was a do or die situation for me, basically. My biggest things after the procedure are self-confidence, number one. I can stand there and actually have a conversation with somebody and not look down or hold my hand over my mouth. Number two is basically health. I feel better. I can move around and not have pain. I wake up in the morning without pain. I go to sleep without pain. It's health and self-confidence all the way for me. My friends and family's reactions was jaw-dropping. If you could see a before and after picture of me, it is completely night and day. The before picture was absolutely terrible. The new picture, I have people still to this day say they cannot believe what it looks like. It's just absolutely amazing.
Well, I started losing teeth through the years. I have a fear of going to the dentist. It's not the pain, it's just being there. So I avoided to go unless it's absolutely necessary. And it came to the point that I have just a few teeth left on the top and in the bottom. There was nothing on the side, so eating wasn't fun. And I like to smile, and I avoided doing that because I was embarrassed. Well, now I have a set of beautiful teeth, so I'm not ashamed to smile anymore or to meet new people. I'm not ashamed to talk. I could go and enjoy any type of a food I like because of the new teeth, and it's just the way you look, you feel more confident, and when you meet somebody you could smile and you know that you look good, and that's a lot. It means a lot.
My name is Marjorie Newhook. I'm happily retired, living in North Carolina, babysitting my grandchildren, volunteering, enjoying life. When I was 16, I was in a car accident and I lost the forefront teeth. My remaining teeth just seemed to always give me problems, so my dentist took the rest of the top out when I was 25, and I've had a denture ever since then. I've never been one to smile because I wasn't happy with my teeth, and I know my daughters, whenever we're together with family pictures, they'll always say, "Mom, show your teeth," and I really didn't feel comfortable. Right now, it's my bottom teeth that are just very achy if I chew anything hard. I eat basically applesauce and pudding and mashed potatoes. I try to keep things soft. I'm very mindful of what I chew and eat. My husband heard an advertisement on radio for Ballantyne dentist, Dr. Christian Yates, and we made an appointment and we went in for an informational night. And we just felt his heart, he was connected to his patients. We really felt his sincere in helping me have a smile, have confidence, be able to smile in a picture again. And I look forward to doing that.
So when I first met Marjorie, she'd already been to several dentists. She'd been looking around. She was suffering from wearing a top denture, and she only had a few teeth on the bottom. And Marjorie's chief concern was, I think, me being able to connect with her. And we were able to do that really from the very beginning. And it's not just about, okay, I want to sell you some dentistry. It's about, let me get to know you and let's build a relationship before we actually jump into anything. So in Marjorie's case, what we did was we removed her remaining teeth and we placed dental implants. And then we were able to place bridges to the dental implants. So when she left, she actually had her teeth in her mouth. And they're a temporary set, but they look beautiful. And over the next few months, we'll be able to dial in the way they look, the way her bite is, and get her really comfortable while everything's healing. And then after about 4 or 5 months, we can finish up with the final product, which is a beautiful set of teeth, which will last her a very long time.
Dr. Yates and his team were very efficient, caring, looking out for my benefit. I'm very happy with the overall outcome. The procedure has changed my life because it gives me more confidence in my smile and my speech. Beautiful smile, you bright up the room, so now I can smile and not cover my mouth.
The most important thing when we're dealing with a new patient for the first time at Ballantuyne Center for Dentistry is establishing trust with that person. And that starts from the very beginning, whether it's the first phone call or when they first come into the office, or we first sit down and we start talking about what their concerns are and their needs are. It's important to build that relationship so that trust evolves. And then once that happens, then it's really easy to start to find solutions to people's problems. And it's also super important that we listen. And listening is something that we do really well here. Our job is to find out what your concerns are and then take those concerns and form them into a plan or a blueprint that has solutions in it for your dental needs.
When dealing with a new patient, it's very key to build a relationship. And that's got a lot of stuff wrapped up in it. We have patients who come here who have high fear when it comes to dentistry, and without building that relationship, finding out what makes them tick, what they want, and how to make things comfortable for them. Without that, it's hard to even talk to them about their options, much less present them treatment if their fear is kind of keeping them from actually hearing. So building a relationship for us is very key when we're talking about sitting down for the first time and talking to a patient. Hey, what are you looking for? How can I help? Tell me any fears you've got, what's hurting, and we really take a real vested interest, find out from them what they're looking for. And the big part of that is listening to them, because I can't tell you how many times they've told us, you know, my last dentist, they just never listened to me. They kind of pushed all the stuff on me, but no one really listened. And that's what we strive to do here when building a relationship, listening to what they want, so that way we can build a plan for them that really encompasses that.
One of the things that's really important to our patients is how much things cost. So I would say the top three things that people fear or keeps people from going to the dentist are time, money, and pain, and not necessarily in that order. So in order to make things easier for our patients, we try to find affordable options for them and help them fit their dentistry into their budget and their lifestyles.
A lot of patients that come here just don't know what they're looking for. They know what they want, but maybe they're not quite sure what kind of options are going to be presented and what they need to do and how much they have to come out of pocket. And that's a very big concern for most of our patients. Well, we like to tell patients that we do have value creation for them. We want to first find out what they want, find out potentially if they've got something big they're planning for, and how to fit our recommendations into their budget and lifestyle. So that's something that really patients are concerned about and what we try to address when we do talk about their dental treatment.
Oh, absolutely. If you ever had an issue where you wanted to, have an issue where you were able to smile and be able to see people and interact with people out in public, plus being able to eat and chew and enjoy food the way I always have, then I would recommend it to anybody. Well, I would tell them that I was hesitant at the same time, but I found that when I was done with the process, it turned out to be one of the better things I've ever done in my life. So there's a little bit of intrepidation and fear when you first do it, but you certainly need to put that aside and know that you're in good hands, and the people that take care of you here make everything you do worthwhile, and the end result has been perfect.
I'm very satisfied with it, and I highly recommend anybody that's considering it to come to Ballantyne Dentistry and get it done. It would definitely be worth it. It will just change the way you think. You don't have to worry about your teeth anymore. It just takes a load off. You don't realize how much you're thinking about your teeth until it's not a worry anymore.
One of my friends recently asked me about the surgery because they're very interested. Their teeth were in bad a shape as mine. We sat and talked about it, and you know, one of their big fears was the pain. And I was quite honest with them. You know, when I first went through the process, I too was very worried about the after surgery pain. I'd read a lot about it. You know, there's a lot of trauma to the jaw and the bone, but again, as I've said, the pain was very minimal. I didn't even stay on my drug meds past the first couple of days. You know, one of the other things he talked about was cost, and what I told him, it's what you want to be. You know, it's worth what you feel your self-worth is. And so, you know, I had no qualms about the cost of the surgery. I think it was well worth it. First thing I tell somebody is do your research. There's a lot of places out there to do this surgery. You know, you read where people go to Mexico and have it done, and they shop for a price. Don't shop for a price. You know, this is one of those things you're going to shop for quality. You know, talk to different dentists, talk to different people, look at testimonials. You know, Google's a great thing. You know, really do your research, because this is an investment for a lifetime, and this is not something that you want to do at a discount.
I would say to them that they have to come in and experience the consultation like I did, and find out that he is really what they advertised for. And he makes you feel so comfortable and so reassuring that I decided right then and there that I will go ahead and do the procedure. The procedure is so easy. You come in at 8 o'clock in the morning and you go home at 3 o'clock, totally different person. Changes your whole personality and the way you feel about yourself. So I would not hesitate to recommend it to anybody to do it.
Do your homework, number one, and check out other dentists and see how well they have done. And just be confident in the choice that you made, that you will be scared. The night before I was scared. I almost wanted to change my mind, but when you know that the end result will be fabulous, you just go with it.
At our facility at Ballantuyne Center for Dentistry, we do almost everything. So we can do teeth cleanings, we do dentures, dental implants, fillings, crowns, bridges, just about everything in dentistry. But our focus is really helping people that have had either bad experiences in the past, or that have a lot of anxiety about going to the dentist, or are just confused and frustrated with all the situations that they've been in with their teeth. And maybe they've been to 2 or 3 or 4 or 10 other dentists, and they're just looking for the right answers. And that's where we really shine, is helping people find solutions to their problems and keeping it affordable within their budget, and having them turn out with a great smile afterwards. Yes, several years ago we developed a number of core values and a mission statement, and we have those around the office, and my team all lives by those core values, and that's how we practice in our office. So like I said, compassion is one of our core values, and so my whole team knows that they have to be compassionate, and they have to empathize with our patients. They have to make people feel comfortable and respect where they are in their lives with their current dental situation. And we're all about helping you get from point A to point B. There's no judgment here. There's no, oh, you should have taken better care of your teeth. None of that exists here. I mean, all we care about is getting you to where you want to be with your teeth and your mouth and your health.
You know, I gotta say, I really felt like I made a good choice here. I mean, everybody is super friendly. Dr. Joe is probably one of the friendliest dentists I've ever been around or been associated with. Just everybody in this office is extremely professional and helpful. As far as the overall outcome, I'm extremely happy. I mean, it's everything that I'd hoped for. I'm very pleased with the quality of the work, with my appearance. My friends tell me I look happier, and that's probably the most positive feedback I've had. My wife constantly tells me how much better I look.
Dr. Yates and his team were very efficient, caring, looking out for my benefit. I'm very happy with the overall outcome. The procedure has changed my life because it gives me more confidence in my smile.
Yeah, Dr. Yates inspired a lot of confidence in me. I felt real comfortable. And when I first talked to him, he wasn't judgmental. He would just put you at ease, and it made it feel really comfortable and reassuring, and that's why I decided to do it, and I'm glad I did.
If you're suffering from missing, broken, decayed teeth, or you have gum disease, or you feel like you're going to lose all your teeth, I would highly recommend calling us and coming in and meeting us and just coming in for a dental implant screening. That way we can get to know you a little bit better. It's a free consultation. We're able to do a complete computerized scan in order to determine if you have enough bone, if you're a candidate for dental implants. And it also helps us to begin to build that relationship. So we can find out if this is a good fit and help you move forward to getting the smile that you've always wanted, but you've never had.
Our team is something we're very proud of. We have a lot of people in our office now over the years that we've hired based on their ability to really have that nurturing attitude with our patients. I feel they understand a high anxiety patient a lot better than most. We pride ourselves on listening to patient concerns and really trying to make our budget, our dental work fit in their budget and lifestyle. Everyone here is really keyed into those points in building relationships, so we're proud of that. Our facility is one, I mean, you don't like to, brag about things, but our facility is comfortable. It's not that stodgy dentistry feeling. It's not that when you walk in you smell that medicine smell. We really have tried to make it comfortable for those who have high anxiety, have high dental fear, to feel like, you know what, this is kind of cool. I think I can get used to this. I think this is the place I want to have my dental work done.